If you're having knee osteoarthritis pain and ever considered getting a hyaluronic acid or cortisone injection, a client and I were talking today about it and weighing the options of the positives and negatives of both. And first I wanted to explain to you what a normal healthy joint looks like. It has a nice capsule that holds the synovial fluid in place. Now there's synovial membrane that creates the synovial fluid. That is created by movement. The synovial fluid has a key role in lubrication, nutrition, protection, immune function, and stabilization. So if you get an injury to your knee, whether it's traumatic or chronic, you can get something called synovitis, which is a degradation of the synovial membrane. As that degrades, it leads to something called osteoarthritis, or breakdown of the articular cartilage. Now, the more injuries you have, the more breakdown that you can have in the knee. And as you can see in this photo here, there's cartilage loss, joint space narrowing, as well as bone spurs. So what do you get? First, I think hyaluronic acid is a better option. It's naturally in synovial fluid. It's a complex carbohydrate molecule that helps with lubrication, shock absorption, nutrient transport, things of that nature. Important stuff. So if you get more hyaluronic acid in your knee, it should help with padding and shock absorption of your knee if you have damage. The secondary option, which is not good in my personal professional opinion, is cortisone. Why is that? Well, you have to understand cortisone is a catabolic substance. So we all know anabolic steroids build tissue, catabolic break it down. So there's also side effects to cortisone: muscle wasting, bone density loss, fat redistribution, impaired healing, and metabolic effects. And what has often happened is someone gets an injection and may help for a week at best, and then they go to get another and another and another, and this catabolic substance breaks down the complex carbohydrates, which is hyaluronic acid, leading to more degradation and damage. So it's a negative feedback loop that just never ends. So the most important takeaway message from this video is that you can create your own synovial fluid through movement. So I had a client today who is in too much pain to walk, cycle, or move, so we got in the pool for aquatic therapy. And I want you to think of the 4 pillars of rehab: flexibility, range of motion, strength, stability. These injections won't help those. That's why getting in front of a professional to teach you how to move depending upon your injury is super important. So at the end of the day, movement is medicine, but if you're going to have to choose, I would go with hyaluronic acid. Reach out with any questions. Aloha.